Good evening, guys. I've got bonus ones for you. Discussion is bonus tonight. We're discussing the importance of palliative and hospice care for terminally ill patients and their loved ones. Key points include death remains a taboo subject, and many people are unprepared to care for someone at the end of their life. Okay, so that's what we're doing tonight for E. So please join me for discussion E. Here we go. This article emphasizes the critical importance of palliative and hospice care for terminally ill patients and their family and their loved ones. Key points include death remains taboo subject, and many people are unprepared to care for someone at the end of their life. Palliative care provides essential support, supplementing creative medicine with care that prioritizes comfort and quality of life. Fear and isolation are common experiences. For those facing serious illnesses, making compassionate care crucial. Okay. World Hospice and Palliative Care Day highlights global efforts to integrate these services into healthcare following. Hold on. A 2014 resolution by the World Health Organization Assembly a holistic multidisciplinary approach is necessary to address the diverse needs of patients and caregivers. The piece urges society to recognize and prioritize the needs of those facing terminal illnesses, advocating for broader awareness and inclusion in healthcare systems. Would you like me to delve into any specific aspects, such as advances in the palliative care or policy implementations? Absolutely. Palliative care is a specialized approach to medical care that focuses on improving quality of life for individuals with serious illnesses. Unlike creative treatments aimed to eliminating disease, palliative care prioritizes comfort symptom management. And emotional support for patients and their families. Key aspects of palliative care: symptom relief, helps manage pain, fatigue, nausea, and other distressing symptoms. Holistic support addresses emotional, psychological, and spiritual needs alongside physical care. Interdisciplinary team involves doctors, nurses, social workers, and chaplains working together, available at any stage. Uh, can be provided alongside creative treatments as part of end of life care. Patient centered approach tailors care to individual goals, values, and preferences. Palliative care is beneficial for people with conditions like cancer, heart failure, dementia, Parkinson's disease, and chronic respiratory illnesses. It can be delivered in hospitals, clinics, nursing homes, or even home care. Would you like to explore how palliative care integrates with dementia care or other specific conditions, given your interest in healthcare innovations? I can I can also highlight emerging approaches in this field. Palliative care plays a crucial role in dementia treatment by focusing on comfort, symptom management, and emotional support rather than creative innovations. Since dementia is a progressive condition with no definitive cure, integrating palliative care helps improve quality of life for both patients and caregivers. How palliative care supports dementia patients. Early intervention. Palliative care can begin at any stage of dementia, offering support alongside other treatments. Symptom management helps address pain, aggression, difficulty swallowing, and other distressing symptoms. Emotional and psychological support. Providers counseling provides counseling for patients and their families dealing with grief, anxiety, and decision making. Caregiver assistance reduces caregiver burden by offering guidance on managing behavioral changes and end of life planning. Ethical decision making helps families navigate complex choices, such as artificial feeding and advanced directives. Okay, advanced dementia and end of life care. Holistic approach addresses physical, emotional, and spiritual needs as dementia progresses. Comfort oriented care prioritizes dignity and well being over aggressive medical interventions. Multidisciplinary team involves doctors, nurses, social workers, and clergy. Okay. Chaplains to provide comprehensive support. Would you like to explore specific aspects, such as emerging palliative care models or ethical considerations in dementia care, given your interest in healthcare innovations? I can highlight advancements in adaptive, deep breathing, or deep brain stimulation, and its role in cognitive support. Integrating palliative care into dementia treatment presents several ethical challenges, particularly in balancing autonomy, dignity, and medical decision making. Here are some key considerations: autonomy versus best interests. Dementia often impairs decision making capacity, making it difficult for patients to express their preferences. Ethical dilemmas arise when caregivers must decide between respecting prior wishes and adapting to the patient's current needs. Okay, 2. Advanced directives and in involunt informed consent. Patients may have documented their preferences in advance directives, but interpreting these later stages of dementia can be complex. Families and healthcare providers must navigate substituted judgment, ensuring decision align with the patient's values. Artificial nutrition and hydration. As dementia progresses, patients may struggle with swallowing, leading to decisions about feeding tubes. Ethical debates focus on whether artificial nutrition prolongs suffering or enhances quality of life. Do not attempt resuscitation. DNRs orders. DNR decisions must DNR decisions must consider the patient's prior wishes, medical prognosis, and likelihood of meaningful recovery. Some families struggle with accepting DNR orders, fearing they equate to withholding care. 5. Caregivers burden moral distress. Families and healthcare providers often experience moral distress when making difficult choices about end of life care. Ethical frameworks help guide decision making, ensuring compassionate and patient-centered approaches. Would you like to explore specific ethical frameworks used in dementia care or discuss emerging policies that address these challenges? Given your interest in healthcare reform, I can highlight systematic solutions to improve ethical uh, decision making, palliative care. Several ethical frameworks guide decision making in palliative care for dementia patients, ensuring that care aligns with principles of autonomy, dignity, and benefits. Here are some key approaches. One, principlism, 4 principles of biomedical ethics. Okay. Autonomy, respecting the patient's wishes even when cognitive decline complicates decision making. Benefits, acting in the patient's best interest to minimize comfort and well-being, to maximize comfort and well-being. Non-malice, avoiding harm, such as unnecessary interventions that may prolong suffering. Justice, ensuring fair access to palliative care resources. Ethics of care, focuses on relationship and compassion, emphasizing the caregiver patient bond. Okay, guys, so that is it for tonight for shows. I'll see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.